Hello, I'm Dr. Maria Sulindro, integrative anti-aging medicine, practicing in Pasadena, California. Today, I'm going to share with you knowledge about SIBO. What is SIBO? It's abbreviation from small intestinal bacterial overgrowth. Well, since I'm going to talk about SIBO for half an hour, I'm going to just use the abbreviations. Hopefully at the end, I will repeat again for people who comes late, then they will know what SIBO is. However, this is not something that is uncommon. Many people have had SIBO for a while and they did not realize that it is a small intestinal bacterial overgrowth problems. And if you go into the internet or anywhere, you can find all kind of informations. But today, I'm going to just discuss about three aspects or maybe four, depending if there is questions, then you will get a different information. The first one is what is SIBO and the symptoms. The second one is how to diagnose. And the third one is what is the treatment. Okay, and if we have time, we can answer a few questions that already pre-asked before these topics live. So the small intestinal bacterial overgrowth is a condition that is serious. It affects the small intestine. So where is small intestine? It's a part of the gut that where all our nutritions absorbed from the food we eat. So when we eat, it goes through our mouth, esophageal, it goes to the stomach, okay, so gaster, stomach, and then it from the stomach, it goes down to the proximal part or top part of the small intestine that is the longest. It's about like 21 to 25 feet. So it's pretty long. And it's there where food, after being digested in the stomach, and then again digested, if possible, in the small intestine and also absorbed. The nutrition is the one that we absorb. And that's keep us healthy, hopefully. Or if you don't eat well, then it won't keep you healthy. So the food goes through the small intestine where the condition is supposed to be sterile there. And it goes all the way until the end of the gut is called colon and come out through the rectum and as a stool or waste products. So the small intestine supposedly it's sterile. Okay, so the bacteria that normally grow in the colon start growing, moving up, and it managed to get to the small intestine that is supposed to be sterile area and causing problems like gas, pain, and it causes diarrhea. For some reason, people have constipation also. Their excess of bacteria means overgrowth, SIBO, small intestine bacterial overgrowth, and happen because majority of these is because it's lack of movement of the small intestine itself. The symptoms, what about the symptoms? These patients usually feel bloated and they have an increased passing of gas. And then they have diarrhea or constipation, and they have abdominal pain. They feel nauseous. They have difficulties eating. They feel fatigue and then weak. Why? Because the nutrition is not being able to be absorbed normally. And they don't feel like eating because they feel nauseous and they have diarrhea. So it's very confusing for them what to eat, and they become anxious, and it causes a lot of stress. The small intestine may not be able to absorb nutrients then, okay? In this situation, the patient, many of them lost weight and they look malnourished. Many of them, many of the patients, they have anemia or iron deficiency. The overgrowth. The overgrowth can be two different overgrowth or bacteria. Remember, we or I or maybe you know about these friendly bacteria and bad bacteria. They're all in our body, and so you cannot choose which one you have to overgrow in the area. Sometimes it is the friendly bacteria, and many times it's the bad bacteria. So the friendly bacteria produce the gas called methane, and uh, the bacteria that feed usually the food that that contains a lot of sugar produce hydrogen. This leads to the bloating, stomach cramp, pain, diarrhea. Okay. So I would like to tell you how to test it in our office. Most doctors, they test using this test and other tests available. But this is a very non-invasive test and it's not 100% accurate. I think the sensitivity and specificity is only like 68%. So you cannot just depend on this test if it's negative. And in the meantime, you see the patient have a lot of problems, so you have to also consider other tests. I'm going to show you the test. Okay, this test is called lactulose because we use lactulose or the sugar. It's a 10 milligram of lactulose, and you drink it. Let me see, where is it? There you are. Okay, it's a 15 ml or 10 grams of lactulose. Lactulose solution, you usually use it for people who have constipation, but this contains sugar. Now, some people end up with endoscopic if they go to a gastroenterologist and they test it with the scope, but it is not deep enough to go in the small intestine. Or they end up with colonoscopy, is they only see the colon area. And SIBO is the small intestinal area. So this test is really unique and smart because what you do, you ask the patient to blow through this and their breath will be in the back. And then we are given 8 tubes for 3 hours, but we usually use only 6 tubes according to when they want you to test. So the 0 minutes and then 20 minutes later, 40 minutes, 60 minutes later, 90 minutes, 120 minutes. So the patient sits for 2 hours and we collect this one, and then we write the time we collected. Inside there is a needle there. So after you blow, you put this the cup here, the connector, and then the needle will puncture the tube here, and then the gas is trapped here, and then you label the tube, and then they will test it for us to see what kind of gas they collect here, and they have the normal references. It's a hydrogen or methane. So shortly after drinking the solution, if the result is more than 20 ppm of hydrogen or methane is more than 10, then it's positive. But usually when you go to a gastroenterologist, they would like to see a very significant increase after like a couple hours, right? We have other, like I said, supporting testing such as immunology testing for food tolerance or stool testing for bacteria and fungal infection, or there is another testing called GI effect, and that will also give you result of get what you can tolerate in terms of eating the food. Once you pretty much make a diagnosis of SIBO, so SIBO is part of the irritable bowel syndrome, but now this one, you find something. Remember, when it's irritable bowel syndrome, it's you couldn't find anything, not bacteria or anything like that. But many patients have both, and so we will treat the SIBO first, and then they still have symptoms, then they are diagnosed with irritable bowel syndrome. But when you see SIBO, small intestinal bacterial overgrowth, then you have to decide what the treatment is. The treatment consists of what you actually found. Let's say they have only hydrogen dominant SIBO. So the primary treatment is nowadays we kill the bacteria in that sterile area with the antibiotic called cefoxam or rifaximin. So this antibiotic is very powerful, and some patients cannot actually tolerate the antibiotics, but we try, if they can, this will kill the bacteria. If they have the methane predominant SIBO, then it's a little bit more difficult, and we combine antibiotic usually with neomycin, and then we see if they can respond to these two antibiotic. I have patients that might need second treatments because the first treatments they improved, and we waited for 4 to 6 weeks, and they think they still have a lot of problem. Then we repeat the second treatments. Many of these symptoms caused by distension of the gut, which can also make your stomach look bigger. But it doesn't mean that if you see someone with a big stomach and they have SIBO, not necessarily. But these patients usually have pain, and because of the distension, they have pain and very gassy. Okay. What to do with, because they cannot eat, right? So what to do with their diet? We call it elimination diet. So if you Google this, or people will tell you what is FODMAP, okay, FODMAP. These are diet that makes the SIBO worse because it's a fermented oligodemonosaccharide and polyol. What is that? So this one is food usually is a short chain carbohydrate and short chain sugar, okay, that are difficult to digest. Normally, even if you don't have SIBO situations, this food usually go directly, is not absorbed, but go directly at the end of the gut, which is the colon, where the gut bacteria resides. And your gut bacteria use this carbohydrate as their fuel to produce hydrogen gas and causing gas and bloated. But if it's in the colon, it's fine because you are going to excrete that waste products. But these happen in the small intestine. It's very uncomfortable. What is FODMAP? So let's just not forget, this is abbreviation of fermented oligodemonosaccharide and polyols. So I'm going to say FODMAPs diet. So you have to avoid FODMAPs when you have these kind of symptoms. And those are, for example, let's say something that has fructose. Now, fructose is a sugar found in many fruits and vegetables that also makes up a structure of sugar, table sugar, or most added sugars. So you have to avoid this because your bacteria likes it. And the next one is, let's say, lactose. You heard of lactose intolerance patients. So this is carbohydrate found in dairy products like milk. So you have to avoid milk. Fructan. Fructan is found in many other foods, including grain like wheat, spelt, rye, and barley. Now, these are now known as gluten. So you have to select gluten-free products or food. What about galactan? Heard of that? That is found in a large amount. That's found in a legume. And normally we suggest legumes for its protein that is not from animals. But here you have to avoid that because it has this complex carbohydrate, And what is polyols? Polyols are sugars, alcohol, like xylitol, sorbitol, maltitol, mannitol. The alcohol sugar. They are found in some fruits and vegetables, and we usually use as a sweetener. Legumes. What is in legumes that you have to avoid? Legumes are usually good because they are bean, chickpeas, lentil, red kidney beans, baked beans, soybeans, right? But now you have to avoid it. Now, beverage such as beer, fortified wines, soft drinks, soda, usually with high fructose, corn syrups, milk, soy milk, fruit juice, all of those because those are sweet, right? You can drink water and tea. Um, Although not everyone is sensitive to FODMAPs, but this is very common to avoid for people with irritable bowel syndrome. What's the benefit to avoid FODMAPs and going it's called low FODMAPs? Well, you have less gas, less bloating, less diarrhea, less constipation, less stomach pain. Of course, it will prevent anxiety and depressions. And some patient finds this diet can be very challenging because it covers a lot of all the food that we normally eat. My phone rings, so let me check some questions here. If you, the question is, if your only symptoms diarrhea for 2 or 3 times a week, what can this be? The answer is this is not that kind of diarrhea, although you cannot rule out, but this is a really like the definition of diarrhea is watery stool, but this is like 5, 6, 7 times a day diarrhea. It's not like 2 to 3 weeks diarrhea, which to me it's a blessing if it happened to me because that's good. Some detoxification of the colon can cause diarrhea. Okay, a good question, but it will you will find the answer as I go along. Okay. Another question is what can SIBO patients eat then? Because FODMAP seems like it is everything. Can you make some suggestion? They ask. Okay, so for the sweet, they can use stevia, monk fruits. It has no sugar, no calories, or molasses. Okay, it has a low glycemic index, meaning low sugar. But stevia and monk fruits do not have sugar at all, and it's sweet, and it's good. Dairy products, you can use lactose-free dairy products or hard cheese, so they don't use milk. Vegetable, list of the vegetable you can eat is long. It can be like bok choy, carrots, celery, cucumber, eggplants, ginger, green beans, kale, lettuce, olives, parsnips, potatoes, but potatoes has a high sugar, radishes, spinach, spring onions, only the green one, squash, again, sweet potatoes, low sugar, tomatoes, turnips, yams, zucchini, right? So for the grain, you can use oats, quinoa. So those are low glycemic index. For beverage, you can, like I said, you can drink water and tea. Okay, one moment. Does the solution, one drink for the test, give one loose stool or make one constipated? Because this one is on the spot and you drink it right away, and it's a small amount. Normally, when you use lactulose, this is for constipation. So it can actually produce diarrhea a little bit more, right? But because you use it just for the test, and normally patients is willing to take a chance, and it's not going to cause too much more problem than what they already have. And this is for a diagnosis, so they are willing to do it. A simpler form that what okay another question is, what kind of food in a, like, simple food, like, when you say, when you tell them the list and they don't know what to eat, right? So food to eat, you can eat meat, fish, eggs, oatmeals, spaghetti made out of squash, head of broccoli, small cups, not a lot, okay? Leafy greens, it's okay, you can eat that. Or you can, I did mention carrots. You can eat, I would avoid rice because rice has plenty of sugar. Gluten-free noodles and crackers, they're available now. And you can choose olive, peanuts, pumpkins, quinoa. Like I said, some fruits is you can do strawberries, blueberries, grapes, and oranges, right? I think, yeah, oranges is okay. Uh, Everyone is different because you may tolerate some foods on the list of foods to avoid, but then your digestive symptoms from the food in the low FODMAP can be plenty. So everyone is different. But what we would like to do for the patient is to eliminate this first. And normally, if the FODMAPs are the cause of your problem, then you may experience relief in as little as a few days, very fast. After 4 to 6 weeks, you can slowly reintroduce some of the food, one at a time, and this allow you to determine which food causes your symptoms, right? So normally I said to my patients, you can start this low FODMAP diet on your own. Too many to explain here also, but they have this list. And if you find it difficult, then please seek advice, so we help you, or a doctor or dietitian who has experience taking care of SIBO patients. The low FODMAPs may lead to improvement, but not eliminate all the digestive problems. Yeah, so at least relieve the bloating and the pain, then at least that, okay? So to prevent unnecessary dietary restriction, other tests such as blood tests to test immunology, like GI effect I said, can help determine whether you need to avoid the FODMAP diet or not. I'd like to tell you about some patient who has risk factors. What's that? Well, risk factors is condition that they have that makes them have a higher chance to get SIBO. Okay, so Um, this is usually an abnormal small intestine situations that restrict the movement of the gut of the small intestine, such as tics or diverticulitis. It's a tiny bulging pouches. It's called diverticula in a small intestine that makes the movement of the small intestine disrupted. Or patients who had undergone bypass surgery for their health. Normally, they're overweight and they want to lose some weight and they can't lose the weight. So the surgeon cut some portion of the usually the right colon or the last part of the small bowel that is near the valve. So it's that has caused problems with motility, which is movement. Scar tissue that develops after radiation therapy, let's say, may cause multiple abdominal um, abnormality movements. And some people have abdominal surgery also can have these kind of situations. So many of these amyloid protein that deposit that accumulates in the small intestine also can change its structure. Some patients that have a low immune system compromised, right? Then they can prone to have this. Some people who have to use a narcotic medication for pain, let's say, or anti-cramp, like antispasmodic medication for irritable bowel syndrome. Uh, the irritable bowel syndrome patient has a lot of cramp, and the cramp is not that it is caused by something. It is like I can say it's like a phantom pain, but it's there. It's in the viscera nerves, so it's in deep in there. So they are given antispasmodic or pain medications. Some people have used medication in the long term to control heartburn or reduce their acid reflux. They also have problems of the motility or movement of the small intestine. And frequently, people have to take antibiotics. And these antibiotics usually or may alter the bacteria in a small bowel. So, okay, just one moment. Yes. Uh, did you say this test is 2 hours long? Correct. Original test designed for 3 hours, and many patients cannot come for 3 hours. So we requested the 6 tube for 2 hours, and they managed to do it. So it's 2 hours. You can do it yourself at home if you are able to, but we help the patient come and then we do it for them. One moment, let me see. Okay. Oh, I have to finish this. This is very interesting. We can prevent SIBO. That's the question. Okay. What should we do to prevent SIBO? Well, if you do not know, there is what we call MMC pathways. What is MMC stand for? Is migrating motor or myoelectric complex. The MMC is what I call gastrocolonic reflex also. So if you can allow this MMC to happen all the time, then you can prevent SIBO. Now, how to make sure the MMC happen? Well, MMC is when you allow hours in between meal. For example, 3.5 to 5 hours. Let the food get digested, go to the small intestine without interruption, and this MMC, the migrating myoelectric complex system or pathways, will um, will push the rest of the waste product to the colon. That way, the movement, okay, is not interrupted if you don't snack. So avoid snacking or eating between meals. These include chewing gums because they even prove it that even you have no calorie in your drink, let's say tea, no calories, it disrupt the MMC. I call it MMC, is the migrating motor complex or myoelectric complex. So number one, you avoid eating in between meals or the snack. You like snacking, then it might have a problem with the clearing of the small bowels. Number two, remember cortisol hormone. That is a stress hormone that will thin the lining of the gut. So you might have leaky gut. If you have leaky gut, then you have inflammation. Then you might interrupt the MMC also. The third one is you have to sleep good hours and good sleep. So try to do this. As you grow older, you lose this ability to sleep normally because you're losing some of the hormone, progesterone, melatonin, right? So we try to explain to our patients about this, and as they can sleep like hours, like 8 hours straight, then the MMC will work during when they sleep. So sometimes you hurt in the morning, your stomach growling, but you're not hungry. That's an MMC. That's MMC pathways trying to clear the contents, and the movement will stimulate the peristaltic, and normally people will go to the bathroom or move their bowel in the morning. So two more. There are five things minimum, and there are more, but I just gave you three, right? Do not snack, and then make sure your cortisol is normal. So reduce the stress by doing, let's say, deep breathing or whatever you use to do to reduce stress, or avoiding food that leaks through your gut. It's called leaky gut. Now, the third one was, what did I say about the third one? Oh, improve the sleep, right? The fourth one is support the vagal nerves. What is vagal nerves? The vagal nerves is the nerve that connects you from the head to the toes. Okay, so these vagal nerves is supporting the motility or the movement of the small intestine. So you should do like yoga, breathing, exercise, do daily exercise, make sure you take occasionally or daily probiotic, a good one, and that will help you also to fight the bad bacteria also, right? And then take pre-kinetic supplements. The last one is like ginger, artichoke, acetyl L-carnitine, tyrosine, 5-HTP. All of these will stimulate this gastrocolonic reflex or MMC. Make sure you have bowel movement. In the future, I will consider doing bowel movement YouTube. Okay. Now, can this one moment? Okay, so can this is the pre-announcement questions here. Can we have recurrent SIBO? Meaning that once you treat the SIBO, will it come back? Yes. So you have to be careful. We advise them to continue not to take food that they are sensitive, and we also help them by checking the top 10 food that they shouldn't take for, let's say, 90 days or 6 months. And then we prevent this closely because sometimes after 4, 5, 6 months, they have this again. As part of our treatment, we recommend following the FODMAPs again, elimination again, and do intermittent diet where you do like maybe 18-6 or 16-8, meaning hours, like 16 no food, 16 hours no food, and then 8 hours eat, and then so I like that. So you if you eat once a day, you have to move once a day. You eat twice a day, you want to expect bowel movement twice a day. That is the healthy bowel movement. In our office, we also cleanse their bowel because we try to help them clean it, and then we give them probiotic, and by doing the hydrocolonic we stimulate the peristaltic of the wall that sometimes are not moving well because of the other um reasons, like drugs, long term taking antispasmodic drugs and all those, or antibiotics. So we exercise the colon again, because otherwise you cannot exercise the colon by just pushing it, right? So this hydrocolonic with a sterile nozzle with the ultraviolet treated water will give you exercise to the big colon. So when the gastrocolonic reflex or the MMC works, then the colon also can move or evacuate the waste products. I have two more questions. Let me see if I have time. I think so. One moment. Oh, wow. So, okay. So basically, it says here, let me answer this one question, very important. Is there shortcut to heal SIBO faster? No, no shortcuts. Health is something that you take effort to do it. You have to learn how to do it. It costly sometimes because you have to eat something that is different than normal, and organic food, good healthy food is so more pricey than the normal food, or junk food, or whatever food is out there, right? So nothing is free in this world, but you can learn from like lecture like this or information like this, and then you can think about it and do it. So closing. So there are maybe like four things to remember. One, SIBO can happen when the gut is not moving, and when the MMC, the migrating myoelectrical complex, is interrupted to clean the contents of the small intestine to the big intestine, which is called colon, for evacuations. So then um, the second one is there is an overgrowth of two kinds of bacteria. The friendly one that produce the methane, which is more difficult, not easy. Yeah. The other one produce the gas called hydrogen, and we can use antibiotic to kill these bacteria. The third one, SIBO diet, which is called low FODMAP, is very personalized. But these fermented oligo D monosaccharide polyols basically take low of this list and wait until symptoms subside, and then reintroduce one by one. The last one is prevention of SIBO. Just now, limit the snack, exercise or move daily, and prekinetic supplements such as ginger, acetylcarnitine, and also what was that? Carnitine, ginger, and then you can also sleep enough. Okay, sleep enough, rest, and reduce your stress and anxiety so your cortisol is low enough. And we can also build again the lining of the gut using, let's say, L-glutamine. All right. Okay, I'm Dr. Maria Sulindro, integrative anti-aging from Pasadena, California. If you like this program, please give us like and subscribe to my channel and share it with your friends. And I will see you in the gut month. This October, I call it gut month, for more topics. And we usually post it prior to the date. It's always Thursday at 5 o'clock. Thank you.